Are you one of them who gives their child a baby bottle or a honey dipped pacifier or some sweetener just to make them stop from crying? Even if the baby is not feeling hungry, you just force a bottle because he should stop crying and he should get a sensation that he is feeding. My parents out there, stop this. Please, it's a humble request that you stop this action of yours. Welcome to my channel Monday Mornings with Mansi. And our today's topic is Early Childhood Caries. Have you been recently noticing the changes in the newly erupted tooth of your child? And they have been turning brownish black. And you can recently also see that all the teeth that have been erupting, they are rapidly changing their colors. Why is that so? Okay, so let me clear it to all of you. The first thing that I had started the video with was, are you bottle feeding for longer duration to your child? Yes, the very and the most important and the most neglected reason for the early childhood caries in your child is the wrong or longer duration of bottle feeding. So what is exactly happening? You are giving your child, or the reason why is this happening, I would say, firstly, bottle feeding for the longer durations. Secondly, honey dipped pacifiers, some artificial sweeteners that you give. Then some sugar syrups, because he has been running ill, you have been giving some syrups or medicines which are sweet. Then some artificial juices or artificial sweeteners. All these reasons lead to this disease, which we call it as early childhood caries. Now, how does this happen? Let us have a look. There are some naturally present microorganisms on the teeth, and this usually the Streptococcus mutans, what we call. These microorganisms are the one which cause this caries. But are they the only one reason? No. So microorganisms, along with the other three factors, they cause the caries. So host is nothing but our tooth surface, means now here our child tooth surface. Substrate, as I said, the reasons, your sweet milk, honey, sweeteners, etc. And time, how much time, like the duration, and how many times. All these things together lead to this early childhood caries. There is a very interesting fact present about this early childhood caries. It usually attacks that surface which is normally not attacked, that is the front surface of all the teeth, or the back surfaces of the teeth from the palate and the tongue side. Usually, if there is normal caries that are seen, they are seen in between the teeth in the small children. But in this syndrome or in this early childhood caries, the usual surfaces are the smooth or the softer surfaces which are attacked. All the surfaces are attacked except the lower 4 incisors, like the lower front 4 or 6 tooth, they are left unaffected. Why is that so? Because the tongue protects them, and also there are salivary glands which are present right behind this teeth. So anatomically it is completely protected by tongue and by flow of saliva. What happens when a baby is feeding bottle with the bottle? All the other teeth, they are deprived from saliva. These microorganisms, along with the food, like the sweet food, they start producing acid. More the production of acid, more the smooth surface it starts depriving or turning into carious procedure is started. How will be the initial noticeable period be? So it will be a whitish patch on the tooth surface, which will usually be between the gums and the teeth. So between the gums and the teeth, a white ring-like structure will be seen. That is nothing but the demineralization. The acid attack has started already. And more the procedure of bottle feeding, more the demineralization, and faster the caries procedure started. Now, you will ask me, what is the treatment? Run to the dentist. Yes, he and she can definitely help you out with this. So, it would be treated in 3 different phases. The emergency phase, Now, what is exactly the emergency phase? The tooth in which root canal procedures are to be performed, or if there is some abscess, that is pus formation in the gums related to some tooth, or some majorly carious tooth. All this comes into the emergency phase. So first, control of caries in that tooth is very important. Sometimes pain is also associated in this situation. So whichever tooth is painful, that has to be treated first. The second phase, arrest and control. Now you can see that caries are growing rapidly. They can also affect your permanent tooth. What will you do? Arrest and control them to the primary tooth. So basically in these conditions, all the teeth have to be treated. Yes, my parents, milk teeth are to be treated. Remember, I have shared a link below that why milk tooth have to be treated and what is the importance of it. I have also shared a picture of before and after of how will this is this situation looking. The third phase is the preventive phase. Now, once you have done the control of this too, you have controlled the caries in the primary tooth, what should be the preventive phase? For the permanent teeth, you should not have this caries. Definitely you want it. So, fluoride application, pit fissure sealants, and the third thing is diet control. So, you parents have to be very much aware. I will be speaking about this preventive phase also in my next videos that what these treatments are, and can only the people having this caries or everyone can have it. Do keep watching my show Monday Mornings with Mansi and subscribe to my channel Dr. Mansi Shah. Please share it with your dear and your ones. Stay healthy, stay happy, be aware of it.